I cannot give you a scientific explanation that can correlate the fact that those prayers were said for me at the replica of the shrine to Our Lady of Lourdes and the vision that I had when I was near death. But there has to be some connection that can be explained on faith. It can't be explained on science. When people say, I don't believe it, there's no scientific evidence, well, there's no scientific evidence now, but that doesn't mean it's not going to exist at some point in the future. We continue to understand, and there's much about this world that, is yet to be discovered.
Hi, everyone, and welcome back to the Shifting Dimensions podcast. I'm your host, Jummie Moses. This podcast is where we explore the unseen, the unknown, and the transformative moments that shift our understanding of reality. Today, I have the pleasure of having a powerful conversation with Dr. Michael Hession. He is a seasoned physician, chief medical officer of Brigham Health Harbor Medical, and a fellow of both the American College of Medicine and the American College of Cardiology. But beyond the credentials and white coats, Michael's journey took an unexpected turn. Between 2013 and 2015, he faced not one, but two near-death experiences, along with profound health challenges. These moments didn't just test his resilience, they completely altered his perspective on life, empathy, and the true essence of healing. What happens when a doctor trained in science and medicine is forced to confront mortality in such a personal way? How do these experiences shift the way we understand health, the human spirit, and even the unseen forces that shape our existence? Without further ado, Michael, I would love to welcome you to the show. Thank you so much for being here.
Thank you much for having me here today.
So, I want to start off with a quote from you. You say, dying was not something I thought about. In abstract terms, I knew death was inevitable for every living thing. I was young and healthy, so this was not a concept I had given much thought to. And I thought it was important to start with this quote because I want to first ask you about the person you were before your near-death experience. What were your beliefs about life and the afterlife?
Well, thank you for that question. I think I was a husband, father of two sons. I was a practicing physician, probably spent more time working than I should have, probably about 60 hours a week, but I had a full life. I was always home to be there with my family when I wasn't on call at the hospital. We would go to church every week. I was brought up in faith. So it was part of my background of who I was. It wasn't something that I thought about every day, but it really, my faith was formed as a child and it stayed with me. This illness, quite honestly, challenged every belief, every fiber of my being. I knew how to be a doctor. I didn't know how to be a patient. And I can tell you from experience, being a patient is much harder than being a doctor. There's so much terror, abject terror that I experienced with this event. It started with a cold in the middle of December in 2013, but it didn't get any better. I went to see my physician. I had a chest x-ray, some lab work done. Chest x-ray showed a small area of pneumonia, but my white blood cell count was normal. I didn't have a fever and my oxygen level was good. So, was placed on oral antibiotics and unfortunately they didn't work. It continued to get worse rapidly. And then I fell off a cliff during the middle of the night on December 31st, 2013. I woke up unable to breathe. My wife had already been awoken by my labored breathing. She's a nurse. And we both knew I was in trouble. And 911 was called. I was brought to the emergency room at Social Hospital where I'd worked since I started practice in 1985. In the emergency room, it was pretty clear I was in severe respiratory distress. My x-ray showed that pneumonia now encompassed both lungs. Both lungs were whited out. This is called acute respiratory distress syndrome. And I think it more recently got popularized with COVID as cytokine storm. I was started on BiPAP, which is a mask that goes from the top of your forehead down to your chin with 100% oxygen forced under pressure into your lungs. And I was brought to the intensive care unit. Unfortunately, the BiPAP really didn't help move the needle as far as my oxygen level was concerned or how I was doing. So I was placed on a ventilator. And to do that, you have to be heavily sedated and paralyzed. It's not a very pleasant procedure. After several hours, they told my wife I wasn't responding to the treatment and that if nothing else was done, I was probably going to die. So they recommended that I be transferred into Boston for a procedure called ECMO, which is extracorporeal oxygenation emitting. It's essentially an artificial lung to take over when your lungs are so severely damaged they can't exchange the oxygen into the blood. When I arrived, I was probably closer to death than I was earlier. And I remember being suctioned. It's an experience I'll never forget. I could hear people talking around me, coming closer, and then there were hands on my face. I felt something in the back of my throat. And then all the air and debris in your lungs is suctioned out. It's an essential procedure. It has to be done to help relieve the mucus and infection that's in your lungs. But it was extremely unpleasant. And after one of these episodes, I just felt everything went black. Time seemed to stand still. I began to feel myself getting colder and being pulled into a distance. And I could hear crying, wailing. The Gaelic term is called keening. I remember that sound from the day my mother died when I was 13. It's a sound that only happens when someone has died, loss of a loved one. I couldn't really quite wrap my mind around the fact that it was me that the sound was made. It was me that the keening was for. Then, after a period of time, and again, time stopped being a dimension. I had no way of knowing how long anything was or anything at that point, other than that I was cold and I was drifting. And then after a while, I became aware of a white light. And I had read stories of people seeing white lights when they had near-death experiences, but this was something new for me. And as the force gently pulled me closer, I surprisingly felt calm. Up until that point, I was severely agitated and anxious. I was terrified. But this was kind of a very strange feeling cold and peaceful. As they came closer, the white light took on the shape of a woman in a luminous white robe. And she said several words that I'll never forget. Michael, it is not your time. You must go back. There is much to do. And then I began to feel myself moving back. The next memory I have is that of my wife speaking to me in my left ear, explaining what had happened, where I was. And I didn't know if I had hallucinated it or whether it was real, but something happened. There was no question, something happened. There's no scientific term that can explain it. It just happened. And I was overjoyed that I was alive and not dead. But the next 11 days on the ventilator were very difficult. The suctioning was relentless and had to be done multiple times a day. And I kept thinking to myself, if I'm in hell and this is an eternity that I'm going to be facing, that I don't know how I'm going to bear it. But I eventually began to get better. And the sedatives that I was given to make being on the ventilator more bearable were gradually withdrawn. Unfortunately, the sedatives, benzodiazepines, and the opioids, they suppress your respiration. So You don't want to give a patient something that's going to suppress their respiration when the goal of what you're trying to do is to get them off of the ventilator. I began to feel the rhythms of the day. Every morning, the lab phlebotomist would come in to draw my blood. They would announce themselves, I'm going to take your blood, feel a tourniquet on my elbow, and they draw the blood and they'd be gone as quietly as they came. One of my nurses was very kind. Every day she came on her shift, she would introduce herself, orient me, tell me the day, the date, the time, and what she was going to do. Those things may seem pretty minor, but I can tell you, when you're intubated and the terror of that experience, not knowing whether you're going to live or die, not knowing what's going on, for someone to treat you as a sentient human being, to take the time to acknowledge your humanity is powerful. I never realized the power that words can have and how calming an effect they can have on a patient. I've taken care of many patients who were in ICUs on ventilators, and we were always taught to talk to them and to be a brief conversation, but not much was said. It was just not as in depth as what these interactions were, but I began to really appreciate the power of treating each patient as a sentient human being. They can hear you. It's immensely comforting. When I first started in a practice or when I was training, it was very unusual for hospitals to allow family members to visit more than 5 minutes, usually 15 minutes max. And they were limited to, several times a day, visiting hours. That fortunately has been changed. They've been relaxed with patient-centered care, and families were encouraged to be with their loved ones. And I honestly never knew how powerful that was. I mean, many nurses didn't like it because it interfered with the rhythm of the day in caring for the patient, the house staff having to do whatever they had to do in the care of the patient. But I think during the COVID pandemic, it became pretty apparent that when patients were intubated and there was no one there to talk to them, everyone realized how horrible that was. And it was really some innovative people that came up with ideas to have family members speak to them with cell phones or on iPads and do FaceTime. I can tell you from experience that was one of the most important things as a patient that you can get: a loved one taking the time to talk to you, to read to you, to hold your hand. You have awareness. And actually, they did a test when I was in the intensive care unit. It's called ABIS, it's bispectral analysis. And it's kind of like an EEG, but it's used to help anesthesiologists in the operating room put patients to sleep so that they're not aware. Awareness while under anesthesia having surgery is pretty unpleasant. So this invention came about with actually, I was a fellow at the Brigham in cardiology. Jummie invented this, and it really took off. And now it's pretty standard in operating rooms and ICUs. I can remember someone coming in one day and doing the test on me. My wife was there, and she's still in there. And I kept trying to say, I know, I'm here, but there were no words that would come out. I couldn't say anything because I was still paralyzed at that point. You're paralyzed to prevent what's called bucking the ventilator. It's an unpleasant thing to have. It's like essentially a garden hose coated with barbed wire down your throat. So you don't want patients moving, it'll just make that worse. And as the sedation and pain medications were weaned off, that sensation, the pain from that sensation of the barbed wire covered hose was very difficult to tolerate. It really tested my limits of sanity. I knew it had to be done if I was to get off the ventilator. And then I was finally, after 11 days, taken off the ventilator and placed on that BiPAP mask. After several days of stability, they decided I was ready to be transferred. Initially, when they came in to do physical therapy, they found that I was paralyzed. I couldn't use my hands. I couldn't move my fingers. I couldn't wiggle my toes. I couldn't swallow without aspirating. And it was thought that this would take a very long time, maybe never fully come back to normal. And the case managers thought I should go to a chronic care hospital. My wife and I decided to refuse this, that we wanted to go to Spalding Hospital. It's probably the best rehabilitation hospital in the country and right in our backyard in Charlestown. And I was accepted. When I got there, a team of people came in and they evaluated me, and they found indeed I couldn't move any muscles. I couldn't swallow. A number of tests were done and they determined that I had Guillain-Barré syndrome, which is a rare but not unheard of complication of viral illnesses. The recovery is about 6 months, but I had never taken care of a patient with that. I had no idea what lay ahead of me, but they assured me that it was highly likely that after 6 weeks that I would be able to get around using crutches. That seemed very aspirational at the time because I couldn't even scratch my nose. I mean, I couldn't move. I had to be taught how to swallow again. The physical therapist and the occupational therapist had to move my muscles every day, stretch my tendons and my ligaments to keep them from freezing up. It was very unpleasant, but it had to be done. The act of just moving the muscles helps to restore mobility, creates a link with the brain, and helps the muscle memory to come back. Week by week, I made progress. After about a week and maybe 10 days, they were able to get me up in a wheelchair and brought me to a small gym on the floor there. I had to do some exercises. They were very, you could hardly even call them exercises. They're just turning a wheel with my wrists. It was exhausting. After about 15 minutes of that, I was drenched in sweat. But they thought I had made progress, so I was encouraged. And they kept telling me every day, keep at it, you'll get better. And I believed in that. And I started to have visitors. My wife brought in bags of get well cards from patients, which were immeasurably comforting. I never was much for sending people cards, but to know that you're thought of you, that someone cares enough about you to write a letter is a very powerful thing when someone's sick. Your world becomes very constrained within those four walls inside in the bed. To know that someone is thinking about you was very reassuring. Then one day, my best friend and his wife came. They brought me a couple of books to read, and they brought me a bag. And inside the bag was a candle from Notre Dame. It was from the grotto to Our Lady of Lourdes at Notre Dame. When Notre Dame was built, it was around the time that Our Lady of Lourdes appeared in France. And they decided to build it a replica. And it hit me. That's what I saw. The lady in white. When I was feeling as though I had died.
Wow.
Everyone just froze when I told them the story. It had never really occurred to me that it actually was a real thing. They said that both his daughters were students at Notre Dame, and they had asked that the students and the clergy pray for me to say the rosary every night when I was sick. So I cannot give you a scientific explanation that can correlate the fact that those prayers were said for me at the replica of the shrine to Our Lady of Lourdes and the vision that I had when I was near death. But there has to be some connection that can be explained on faith. It can't be explained on science. I was grateful, and I swore to myself that when I got better, my wife and I would go to France and visit the shrine to Our Lady of Lourdes, which we later did. The 6 weeks at Spalding were arduous. The physical therapy, 3 hours a day, plus you had to do homework exercises at night. And it was exhausting. I frequently had to nap. One night, my wife said, I want you to see something. But this time I was able to walk with crutches. And she brought me over to the window and look out there. And it was a vacant field across from the Spalding Hospital in Charlestown. It had snowed. Someone had taken the time to draw a gigantic heart the whole length and breadth of that vacant lot. And the words, I love you. I don't know who did it, but I think anybody who saw that had to feel the love. So I think faith is a hard thing to explain. I think either you have it or you don't. There's a famous quote from World War II during the Battle of Bataan that a member of the clergy gave to the soldiers facing battle. And he basically commented, there are no atheists in foxholes. I would also say, based on my experience, there are no atheists in ICUs either. I got stronger, and one day in March, the weather was good, so they let my wife take me out in a wheelchair to the grounds. It was amazing just to feel fresh air. I hadn't felt fresh air in a month, over a month, and it was intoxicating, even though it was cold. It was bitterly cold. But in my mind, I began to think, well, I'm going to be home next week. That wasn't going to happen. I fell victim to what is commonly called the Stockdale paradox. It was a description that Admiral Stockdale, when he was a prisoner of war during the Vietnam War, for 6 years, he spent much of it in solitary confinement. And when he got out, he said, you and your men really psychologically have done so much better than others. What do you attribute that to? He said, we never lost sight of the fact that someday we would get out. But the prisoners who fixed on a date, Christmas, Easter, Thanksgiving, the 4th of July, when those dates came and went, they became despondent and they withered and they died. Viktor Frankl, in his book, Man's Search for Meaning, he described his internment in Auschwitz, made a similar observation. He said, when a person loses the will to live, they die. The people that get lost mourning the past that can't be returned, or they become overwhelmed by the horror of the present, they wither and die. It's only the people that can look to the future and find some hope that someday, somehow, things will be better. Those are the ones that survive. And I have to say, it's true. I hit that wall when my day that I thought I was going to go home came and went. And one of the first times I really cried. I cried so hard, I cried like a baby. I felt stuck that I didn't know what to do to get unstuck. And one of my therapists she had a passion for ballroom dancing. And she used to do it professionally after work and on the weekends. So one evening when my wife was visiting me, she said, I want to take you to the gym. So I got wheeled down to the gym in the wheelchair. And then she had a little boombox she started. She started playing music. So the gym is huge. It's several stories high. It's enormous. But the acoustics were amazing. It felt like you're in a concert hall. And then she said to me, our physical therapy lesson for the day is you're going to dance. I'm going to teach you how to dance. I was like, what? That can't be possible. It says, no, you're going to dance. So she helped me get up out of the wheelchair. My wife took a hold of me and she started teaching me first how to put one foot in front of the other, how to do the waltz. And it was like a light from above hit me. It was like I became unstuck. I saw hope. I saw a future. And it was a little thing, but it made all the difference in the world. And I think when you're taking care of patients, it's an awesome responsibility. It's the most powerful honor in the world to care for another human being. And this young lady took the time to get to know me and my wife and find a way to get me unstuck. Part of what I forgot to tell you is that 2 days before that, they knew I was feeling down. So they brought a therapy dog to see me, except I was on precautions because of my pneumonia. So the dog wasn't allowed to come into the room. I wasn't allowed to pet the dog. So the dog just sat there in the doorway. I was looking at the dog, looking at me. I think whatever good intent was meant, it kind of backfired. So that story with that physical therapist taking the time to find a way, with the help of my wife, to get me unstuck made all the difference in the world. It's a powerful thing to have the honor to take care of other human beings. And my gratitude to the physicians who saved my life at Social Hospital, Brigham Women's Hospital, and to the staff at Spalding Hospital that helped restore my mobility, I'm eternally grateful. One thing that I want to mention that started happening around midway when, maybe about the second week, I began waking up with nightmares that I had stopped breathing. And the staff would come in and reassure me that my breathing was fine, but the nightmares wouldn't stop. And one day, one of the physicians came in and said, Michael, I think you're showing early signs of post-traumatic stress disorder. I knew what that was, but I thought it was something that was only occurred in soldiers in combat or people who are victims of violence. I didn't realize at the time that it can happen to patients and their loved ones with critical mental illness. And I later went on to do a lot of research on that, and it's not very well understood or very well known that this is a real thing. And many times patients come in to see their physicians after a major operation. Say for me, patient had a heart attack and had to have emergency bypass surgery. Several months later, they'd come in and say they were having nightmares and having trouble sleeping, and they'd been put on sleeping pills. And really, no one at the time knew, and even now, it's not widely appreciated, that PTSD can occur in patients following critical mental illness as well as their family members. Also, it can happen to the doctors and nurses and therapists that take care of patients. I think that explains why, at least in part, why 20% of the healthcare workers following the pandemic quit. It was just overwhelming. And I think it's probably reflected in some of the red flag warning signs of PTSD that we see now with increased drinking and increased drug use. But like any problem, the first step in solving it is to acknowledge it. And I think one of the most powerful messages I want to get across with your show is that if people who had become victims of critical mental illness, or their family members, or their healthcare workers who were involved in the pandemic, if they're struggling, seek help. There is treatment to get you past it. It's very effective. But you first must acknowledge the problem. Otherwise, there's not much chance it's going to get better on its own.
Thank you so much for sharing your story. Just to summarize it for the listeners, you know, you're a doctor working 60 hours a week. You get pretty sick in 2013 and you find yourself in the hospital fighting for your life with pneumonia. And you don't die. You have a near-death experience where you do cross over to the other side briefly, but then you are put back into your body. And especially due to the prayers of your wife and your larger community, and then you spent the remaining 6 months really recovering. And it was a very arduous process, mentally challenging, physically challenging, I'm sure spiritually challenging as well. In your words, a lot of that experience really felt like hell. But throughout that experience, you were met with so much love, so much kindness from the doctors and nurses and healthcare practitioners that were helping you throughout your recovery. What I want to ask is, you said at the very beginning that you hadn't thought too much about the afterlife, though you were a man of faith, you are a Christian, you didn't think too much about the afterlife. After that experience, did it change your thoughts on the afterlife? And I'm saying that specifically because since you are medically trained, a lot of times I find that when I have conversations with people who are very science-based in their profession, they look for evidence in a lot of things. And if things come across their table that you can't really explain or measure, a lot of that is pretty much, I would say, somewhat ignored, right? But you talked about how the prayers that you received really helped in, you believe that they helped to bring you back into this physical reality to continue to live out your life. So I just want to hear your thoughts more on where you stand in terms of the supernatural and how you kind of balance both that aspect with your science-backed background.
Sure. I think I have been changed. I feel the whole experience made me a better person and a better physician. I'd never thought much about death, as I said earlier, but I was afraid of it. I think everyone's afraid of the unknown. I now don't fear death. The experience I had was very peaceful. I don't know how long it lasted, but the terror that I felt at the beginning was completely gone after that experience. I think in medicine, it's humbling. There's so much we don't know. I graduated from medical school in 1980 from Dartmouth. My son graduated from NYU in 2013. Medicine has turned over probably completely 3 or 4 times in that time period. What we thought we knew in 1980, by 2024, 2025, was wrong. Many of ideas about disease, many of the medicines we used back then, we no longer use. We know better. We're continuing to learn more about the human body, about healing, about illness, about medications. I think we're living in an incredibly exciting time. We're turning diseases that were death sentences into treatable problems like high blood pressure or diabetes. AIDS was a scourge. When you got it, it was a death sentence. Now people can live normal lives. It's not cured, but you can live a normal life. Before insulin was invented, diabetics died very young. They didn't live to old age. Both my parents died of cancer. They died horrible deaths. There wasn't much at all to offer them in the 60s and 70s. Now, many cancers are curable. Many others have been turned into chronic diseases, more likely to die from something else than cancer. I think we're learning a lot about the mind. There's so much we don't know. I think it'd be very arrogant to be dismissive of something just because you don't know the answer. I think the answer may be found sometime later on in life, but I think it's unfortunate that so many physicians tend to be arrogant. But my experience has been a humbling one. And there's much I can't explain, but I think, as I said, we're learning more and more every year. And in your lifetime, you're going to probably see some amazing things, cures to diseases that seemed incurable. People will be living well into the hundreds, active and full lives. So I think that when people say, I don't believe it, there's no scientific evidence. Well, there's no scientific evidence now, but that doesn't mean it's not going to exist at some point in the future. We continue to understand, and there's much about this world that, is yet to be discovered. That's how I'd answer that question.
I agree with you. And my personal philosophy is the more you know, the less you know. So I think I naturally have a hyper curious way of operating. I'm a very curious person, so I'm always asking questions. I'm always leaving room for the unknown. But I know a lot of people struggle with that, and I appreciate you for kind of acknowledging that it is somewhat arrogant to feel like we have all the answers or certain things are impossible. We live in a world where there's so much we don't know. And some people have described us as being cosmically blind, for example. So I appreciate you for saying that. Something else I want to talk about, and I think is very important, is that this harrowing experience started for you in 2013, but you didn't write a book on this until 2020. And the book is called Physician Heal Thyself, Nearly Dead and the Journey Back to Health. What made you decide to write the book in 2020, and why is it important for doctors, and not just doctors, but especially physicians, to read this book?
Excellent question. A friend of mine came to visit me when I was at Spalding Hospital, another physician. And he said, "Your story is amazing. You should write a book. And I'd like to give you, like at some point when you're better, to give a speech." At the time, I couldn't really write. I was struggling to learn how to feed myself. But he kept insisting that I keep this in the back of my mind. And one of the things they encouraged is Spalding is to keep a journal. Somewhere, maybe about by the fourth week, I was able to legibly write. So I just started keeping notes, ideas, thoughts, and I kept adding to them. In 2015, we visited my son who was getting a master's at the Sorbonne in Paris. He was an amazing tour guide. He took us all around Paris, took us everywhere. And then we took a short flight to the Lourdes Shrine, which was very powerful and very inspiring. But when I came back, I got sick again. I got diverticulitis, developed an abscess, I had prolonged antibiotics, and I had a surgery. Some of the medications that I was on because of the ARDS impaired my healing. The incision came apart. I had an abdominal catastrophe, my second near death. And when I woke, I had to have emergency surgery, have an ileostomy. I was back to square one. It seemed actually beyond square one. I didn't know how I was going to recover from this. And I was lost. My sister called a friend of ours, a neighbor who had become a priest. I known him since I was a child, and the Jesuit priest. And he came to visit me. And he just spoke very kindly. He reminded me of my father. My father immigrated to the United States from Ireland when he was 17 in 1929. And it was a very bad time to come to the United States. But life was harder in Ireland. He was one of 14 children, third child. The oldest son got the farm. My father said he was given a handshake. So he had to learn to fend for himself. And he felt that life would have more opportunities in the United States. He'd only had a sixth grade education, but he said if you weren't afraid to work, you could find a job, and if you found a job, you could eat. He said some days he didn't know what he was going to do, but each day he just put one foot in front of the other and found a way to go forward. And he reminded me of my father's story. And then it stuck and it resonated. And I fought back, recovered, got back to work. And things are going well. And I was supposed to have had my left hip replaced in January of 2014, but I was otherwise occupied. But it was still very painful and it was impeding my ability to sleep. So I had my hip replaced the first week of January of 2020, right as the pandemic was starting. My son was a senior resident working in a hospital in New York at Bellevue. It was ground zero for the COVID epidemic in the United States. And he would, on his way home from work, would tell us of all these refrigerated morgue trucks that were lined up, several more each day. And when he came into work the next day, there'd be several more. And the news was filled with, stories of people who were dying. And recalled there was one compelling story of a person who had ARDS, cytokine storm, was being discharged. He was in a wheelchair. He was too weak to walk. And I felt like I needed to do something. Obviously, I couldn't. But I thought that maybe I could share my story. And so I found the journals that I had kept, and I started writing. The sentences, the paragraphs that I wrote turned into chapters. I began to work with an editor, and the book took form. And I worked for a couple of years writing the book and got it really, it was almost done. Then in the summer of 2022, I was diagnosed with cancer and I had to start chemotherapy. Chemotherapy was pretty rough. One of the side effects was I developed a painful peripheral neuropathy. I couldn't dress myself. I couldn't button my shirts. I couldn't cut my food. It was horrible. But the chemotherapy worked. I'm in remission. And by the summer of 2023, I began to write really in earnest. I wanted to finish this book. I plowed through it with my editor, and it got published this August of 2024. And it's been an amazing experience. Writing the book in many ways was therapeutic. It helped me overcome a lot of the emotional trauma of the illness. And in a way, it became a form of cognitive behavioral therapy, which is how you deal with post-traumatic stress disorder. It was difficult to write the book, I'll be honest, but I stuck with it, and it worked. I mean, I overcame the PTSD from the illness, and since the book came out, I've been invited to speak a number of places. I found some of the best reviews I've gotten have been from doctors and nurses and respiratory therapists who are very moved by the book. They didn't realize the impact of what their actions were on patients. It's very rare that patients circle back and tell you what their experience was being intubated in ICU. When I did my literature search, there's really very little out there on it. So I think the motivation really was my need to do something in this horrible time that our country went through. And in sharing my story, I felt that I could help patients and family members process some of the traumas that they've been through. But also it's resonated very greatly with the medical community. And I've been asked to give a number of other talks. And I started doing these podcasts last fall, and I've been getting a lot of requests to be on shows to share my message.
I think you have a very powerful message. Again, I was so interested in speaking with you, and why I reached out is because I think as a doctor, you becoming a patient for several years, you offer a perspective that I think is very necessary within the medical community, but outside of the medical community, a lot of the themes that you talk about is this need for empathy. And I think empathy and showing love and kindness to our fellow human being is very important. And I think especially being in the field that you're in as a physician, as a doctor, there's a lot of compassion and empathy that's required with the job, right? And not saying that a lot of physicians and doctors don't have that, but I think it's important to be reminded about how important that is and how it's needed for the healing of the patient a lot of times. So thank you so much for sharing that. I have to ask you an important question and before we start wrapping up the show, and that is, what are your thoughts on the purpose of life? I know before your near-death experience, again, you were very devout in your profession and you still are. I wonder if your thoughts on the perspective and purpose of life has shifted since then.
It's not shifted as much as it's become refined and validated. I did a lot of reading when I was recovering, and I'll read you a quote. This is from Albert Schweitzer. He was giving a speech in New York many years back. Success is not the key to happiness. Happiness is the key to success. If you love what you are doing, you will be successful. The purpose of human life is to serve and to show compassion and the will to help others. I don't know what your destiny will be, but one thing I know, the ones among you who will be really happy of those who have sought and found a way to serve. And I truly believe that. And I've said in my talks to physicians and nurses that the true superpower they have is empathy and compassion. Unfortunately, as you alluded to earlier, it's not taught in medical school. There's no courses on it. You can't grade it. You can't really measure it easily. But patients really prize it in their healthcare providers. And you can always tell the physician or the nurse who has empathy and compassion. It's very different from just doing your job, even doing it well. The empathy and compassion shows through, and it is a true superpower.
Thank you. It's really about leading with love. So this has been such an amazing conversation, and I'm very confident that my listeners are getting so much from this conversation. I asked my guests one final question before we wrap up the show, and that is, have you shifted in perspective on anything recently? And it could be as lighthearted as you want it to be or as deep as you'd like it to be.
No, I've learned that you have to enjoy and live every day to the fullest. Do not take your loved ones for granted. Do not take life for granted. Do not take health for granted. No one knows what's going to happen next. Not to be hedonistic, but to lead your life with love and compassion and caring for others. I was taught by the Jesuits in high school and college that we are all our brother's keepers, and I truly believe that. And the experience that I've gone through have really made me a true believer in that philosophy.
That's my personal philosophy as well, because I think showing love and kindness, no matter what profession you're in, no matter who you come across, I think is a superpower that we all need to adopt because it all makes us better for it. So thank you so much. Where can people find you if they want to learn more about you or purchase your book?
You can purchase my book on Amazon or through Barnes and Noble or any major bookstore. It's called Physician, Heal Thyself, Nearly Dead in the Journey Back to Health. My website is www, all lowercase, acknowledge, accept, adapt, all one word. And it has my knowledgeacceptadapt.com. It has my biography, and I keep a blog and I put interesting things in there, thoughts and observations. I think people will find it helpful.
Thank you again for stopping by Shifting Dimensions. It was a pleasure having you on the show.
Thank you for inviting me.